Greetings, my name is Kendra Cobb. I'm here to present to everyone the pharmacology presentation. So first we have our agenda of the presentation. First we're going to highlight the key terms that are going to be focused on throughout the presentation, and then we're going to talk about each mental health disorder that has primary, secondary, and tertiary medication options, and then we'll follow up with a alternative intervention within each disorder. So first we'll focus on anxiety disorder, then bipolar and mood disorder, personality disorder, schizophrenia spectrum, trauma and adjustment disorder, limitations within anxiety disorder, and within in regards to medication options, and then also ending on social work ethical practices. So, looking at our key terms for the presentation, we have SSRIs, which is an acronym standing for selective serotonin reuptake inhibitors. Then we have SNRIs, which is serotonins and norepinephrine reuptake inhibitors. Then we have our primary, which aims to prevent immediate addressing symptoms. Secondary, focusing on the early detection and promptly intervening for limiting the impact of the symptoms. Then we have tertiary, focusing on reducing the impact of symptoms and long-term effects. So focusing on the anxiety disorder, so we have our primary medications such as Zoloft, which increases the serotonin to regulate mood and anxiety. Then we have the secondary medications, Effexor, which increases serotonin and norepinephrine that attempts to reduce anxiety symptoms. And then our tertiary medications, such as a medication called lorazepam, aims to enhance the neural activity for rapid symptom relief. And there are some limitations within this medication due to the dependence risks that come along with it. And so an alternative intervention in lieu of medication could be cognitive behavioral therapy, which assists with reducing maladaptive thought patterns and behaviors. Next, we have our bipolar and mood disorders. So our primary and secondary and tertiary medications are all listed here. So the primary, lithium, which regulate neurotransmitter signaling and reducing manic depressive episodes. Secondary medications may be called Depakote, Lamictal, and which aim to stabilize neural firing and mood fluctuations. And then we have the tertiary medications. On an example would be Zyprexa, which aim to target dopamine and serotonin to manage acute mania and bipolar depressions. And an alternative intervention could be the psychoeducation and interpersonal therapy to improve medication adherence and mood regulation. Next, we have our personality disorders. So within our personality disorders, medication does not cure personality disorders, but can target specific symptoms. So you have your SSRIs and mood stabilizers that are often used to reduce emotional dysregulation. And so you have the dialectical behavioral therapy that can be used as standard for borderline personality disorders, teaching clients to distress tolerance, emotional regulation, and interpersonal effectiveness skills. And so within the medications, also the primary, we have an example of a medication called Prozac, and then the secondary medication called Zyprexa, and then a tertiary medication called Lamictal. Next, we're looking at the schizophrenia spectrum. So we have our primary medications, which could include the Risperdal or Zyprexa, which block the dopamine and serotonin receptors to reduce positive symptoms. Then we have the secondary medications, which could be an example of Haldol or Thorazine, which is a dopamine antagonism for psychosis control. And then we have our tertiary medications. Also, an example of this medication could be the Clozaril, which is reserved for treatment-resistant schizophrenia, which requires close monitoring with this medication. And so an alternative intervention would be that psychosocial interventions that improve functional outcomes and community integration. We have our trauma and adjustment disorders, and so with the three medications, we have the alternative intervention. So the primary, we have an example would be Zoloft or Paxil, which regulate the serotonin throughout the brain and body to reduce the PTSD symptoms. Secondary medications, such as an example would be Effexor, you could use that addresses the hyperarousal and depressive symptoms. And then the tertiary medication, also known as the prazosin, reduces trauma-related nightmares via adrenergic blockage. And then we have our alternative intervention, which is trauma-focused cognitive behavioral therapy or eye movement desensitization and reprocessing exercises. Next, we have our anxiety disorders within limitations to the medication. So medications do not address root cognitive or trauma-based causes. There is risk of dependence, and there could be side effects such as sexual dysfunction, weight gain, emotional blunting, or variable response across diverse populations. Then we have our benefits to all the alternatives, such as specifically the cognitive behavioral therapy, also known as CBT. So it's demonstrated the effectiveness equal to or exceeding medication for long-term anxiety management, builds coping mechanism skills and relapse prevention, and also empowers the client autonomy and reduces reliance on pharmacology. And so the social work ethical practices, so within social welfare, the advocacy for equitable access to mental health treatment beyond medication, the public participation, engaging in policy discussions addressing pill mills and overprescribing, public emergencies, responding ethically to opioid and psychotropic medication crisis, and then also social and political action. We can challenge big pharma influence and promote evidence-based prescribing practices, and the continued education and training to improve and provide adequate services, diagnosis, treatments, and interventions, such as using AI, training, client perspective, webinars, and education as an ongoing training purposes for our communities, for our social workers, for clinicians, and teachers as well, and our doctors. And so social workers are the bridge between doctors and psychiatrists. And so for that ongoing equitable services that is being provided and support to our clients, despite mental health diagnoses or medical conditions. And so we have questions and answers section, and then we have our references. And thank you so much.